Hi, I'm Ernest Rogers, and I have osteogenesis imperfecta. I believe it's type 3. I'm not sure what type it is. I was first diagnosed with it when I was born, I guess. My childhood was it's kind of unusual in the fact that when I was born, I ended up in Shriners Hospital for Crippled Children in Shreveport, Louisiana. It's very important that you listen to your patient. Your patient is afraid, number one. One reason why people are afraid of doctors, I found out, especially from being from the South, is they scared of bad news. You know, if I go to the doctor, I may have cancer. So they avoid it. They avoid it long because they're afraid of the doctor. But if a doctor gets to know the patient, then it's kind of easy when he got something bad to tell him and all that. Because Dr. Probine could tell my mama all kind of stuff about me, you know. And he knew me. And Dr. Bailey knew me. Dr. Strange knew me. Dr. Berg knew me. Dr. Nuño knew me. Dr. Wagner knew me. And they treat me like I'm a friend and like I'm a person. But you got to be cordial. We were talking at work the other day how people doctors get on the computer and you say what? And you say what? But they never examine, never touch the patient. That's not good. That's not good. And to me, that's not a good doctor. I would leave that doctor's office not happy and try to find me another one. But the doctor that would sit down and talk to me like Dr. Wagner did, I mean, she got to know me real good. And I mean, it seemed like it might be bad but that she ran a bunch of tests or that she takes so long. It wasn't, because I know more about me now, and I know when there's something really, really out of whack. And if it wasn't for her coming up with the idea, I never would have met Dr. Nuño, who treats me for a pain I was having. So every now and then I come get readjusted by the magic fingers of Dr. Nuño.
I wish I was enthusiastic as Ernest, but it's awesome to have him as a patient. I've learned a lot from him. When Dr. Wagner first came to me, she pulled me aside and said, I have this patient who has osteogenesis imperfecta. You know, I think he could benefit from OMM, and we were discussing, she always asks me before she sends me a blind consult, do you think this would be a good consult? And I always say yes before I even think about it, because I think everybody can benefit from OMT. It's just a matter of how much and what I'm going to do, which I didn't know what I would do. But first step was obviously doing a really good history and getting to know him and doing a physical exam. And the history was interesting. There was a lot there, and obviously you can tell that I was very entertained by his stories and his history. And then the physical exam was really interesting because I didn't realize at the time, but he has a lot of pseudo joints, and so I was examining his shoulder, and I was feeling that there was a joint between the shoulder and the elbow, and I'm thinking, what the heck is going on here? So I'm trying to assess strength and trying to look at reflexes and doing a good MSK exam, and it just wasn't working very well.
I'm gonna nickname this the Skip Hump. That's my little brother's name. This is because me and him used to wrestle all the time, and that's what that is. Let's see, which one's my elbow? Can you pick it? Can you pick it out? Which one? This is my elbow right here. Actually, that's my elbow, and this is my pseudo. Here's my other leg. See, and this one's worse. And the reason why it's worse angle is because I broke it one time, and I set it under a pillow, and it felt comfortable with it down like that, and that's why it's worse. And then before I went to the doctor, I did that.
I had to sort of come back to the guiding principles of osteopathy, which is what I love. The first day of OMM, you learn how to take care of a patient when you don't know what else to do, which is you go back to treating them as a whole person and looking at their unique structure and what functions for them. And for him, it was about, okay, what is going to work for him? What can I find that I can help him with? And I knew that certain techniques weren't going to work. Obviously, you're not going to do high velocity. And I don't even think muscle energy is appropriate because I don't know the integrity of some of the muscles and pulleys and how the joints are going to work. So I honestly didn't have any idea how well it was going to help. I was sort of like, well, we're going to try this. But the nice thing is that OMM allows me to adapt my treatment to the unique person that he is.
He found it. That's it. Yeah.
So we're going to call it a 10, and we're going to try and move your leg around to make that less, okay? Usually you need a lot of flexion.
And this is odd because if you saw the oh, there you
How's it now? If it was a 10 initially, what is it now?
go.
Right here, if you don't mind.
Go ahead.
Zero?
Yeah.
All right, cool.
And,
If you're uncomfortable, I'm pretty comfortable.
and it's cool, but you got to let yourself relax too. Because if you don't, it's just
Relax your legs.
all right. That's so good. Yeah,
Hold on now.
it's gone.
So, are there any other spots that we didn't hit?
No, you got them all.